Many warning signs of poor brain blood flow don't feel serious at first. They don't cause pain, they don't last long, and they often disappear before you can fully think about them. You might feel slightly dizzy for a few seconds. Your vision may blur briefly, or your thinking feels a little slower than usual. Most people over 70 quickly dismiss these moments. They assume it's just fatigue, or stress, or simply part of getting older. But the brain depends on a constant, steady supply of blood. Even short interruptions can affect how it functions. The problem is not that these signs appear. The problem is that they are often ignored. Understanding these early signals is not about fear. It's about awareness. Because what you recognize early, you still have time to respond to. For many seniors, these small moments don't feel worth mentioning. They come and go quickly. And most days, life continues as usual. You may tell yourself it was nothing, that you were just tired, that you didn't sleep well the night before. Friends often say the same thing. Family members reassure you. Even conversations with doctors may focus on bigger issues, leaving these brief symptoms unspoken. Over time, this creates a pattern. Small signs appear, they disappear, and they are quietly accepted as normal. The truth is, the brain is extremely sensitive to changes in blood flow. It requires a steady supply of oxygen every second. When that flow is even slightly disrupted, the brain reacts quickly. But the reaction isn't always dramatic. It's often subtle. A moment of lightheadedness, a brief lapse in focus, a short feeling of imbalance. Because these signs don't cause pain, they're easy to overlook. Because they don't last long, they're easy to forget. This is why many seniors are surprised when doctors later talk about circulation or brain health. They never felt seriously ill. They just didn't realize their body had been sending quiet signals all along. What makes this especially confusing is that aging does change how the body feels. Energy levels shift. Recovery takes longer, and sensations that once stood out may now blend into the background. But not every change is meaningless. Some are messages. The challenge is learning which signals deserve attention and which are simply part of daily variation. Ignoring everything may feel easier, but awareness creates options. Recognizing early signs of reduced brain blood flow doesn't mean something bad is happening right now. It means the body may be struggling to adapt as smoothly as it once did. When these signs are noticed early, seniors often still have time to respond thoughtfully. Time to support circulation, time to protect balance and clarity, and time to maintain confidence in everyday movements. Understanding this difference is the first step towards staying proactive rather than reactive as the body changes with age. The brain may only make up a small portion of the body's weight, but it uses a large share of the body's blood supply. Every second, it depends on a steady flow of oxygen and nutrients to function properly. Unlike muscles, the brain cannot rest. It works continuously, even when you are sitting quietly or sleeping. This means it has very little tolerance for interruptions in blood flow. When blood reaches the brain smoothly, thinking feels clear. Balance feels stable. Reaction time feels natural. But when blood flow is reduced, even briefly, the brain reacts almost immediately. Not with pain, not with obvious warning alarms, but with subtle changes in how it functions. You may feel slightly lightheaded. Your vision may dim or blur for a moment. Your thoughts may feel slower or less organized. These reactions are not random. They are the brain's response to receiving less oxygen than it expects. As we age, the systems that regulate blood flow become less responsive. Blood vessels may stiffen, nerve signals may slow, and the heart may take longer to adjust pressure when the body changes position. When these adjustments are delayed, blood flow to the brain can dip briefly. The brain compensates. The sensation passes, and life continues. Over time, however, repeated brief interruptions can strain the system. The brain adapts by becoming more sensitive. Small changes that once went unnoticed may start to feel more frequent. What makes this process difficult to recognize is that it develops gradually. There is no single moment when something feels clearly wrong. Instead, there are small signals scattered over weeks or months. Many seniors assume these signals are simply signs of aging. But in many cases, they reflect how well the brain is being supplied with blood in everyday situations. Understanding this helps explain why early warning signs often feel vague or inconsistent. The problem is not constant lack of blood. It's the body's reduced ability to deliver blood quickly and consistently when the brain needs it most. Recognizing this pattern shifts the focus from isolated symptoms to overall circulation and responsiveness. And that understanding makes it easier to see why early signs deserve attention, even when they seem minor. Next, we'll look at one of the most common early warning signs many seniors experience. A sign that often appears briefly and disappears just as quickly, making it easy to overlook. One of the earliest and most common warning signs of reduced brain blood flow is brief dizziness. It often lasts only a few seconds. And because it passes quickly, many seniors don't think much of it. This type of dizziness usually happens during simple movements. Standing up from a chair, getting out of bed, turning the head too quickly. The sensation may feel like lightheadedness rather than spinning. You might feel slightly off balance, or as if the room shifts for a moment before settling. Because it's mild, people often blame it on standing too fast or being tired. They wait a second. The feeling goes away, and they move on. What's happening in these moments is often a brief delay in blood reaching the brain. The brain expects an immediate adjustment in circulation when the body moves. When that adjustment is slow, even by a small amount, dizziness can occur. This doesn't mean something dangerous is happening right away, but it does mean the system is working harder than it should to keep up. Over time, repeated episodes of brief dizziness can signal that blood vessels are less responsive or that circulation is not adjusting as smoothly as before. The body compensates, but compensation requires effort. Many seniors unconsciously change their behavior because of this. They stand up more slowly. They pause before walking. They reach for support without realizing why. These adaptations help avoid discomfort, but they also mask the underlying issue. The key point is not how intense the dizziness feels, it's how often it happens. Occasional lightheadedness can happen to anyone, but when brief dizziness becomes a regular pattern, it deserves attention. Recognizing this sign early allows seniors to support circulation and balance before confidence is affected. It's not about fear. It's about noticing what the body is quietly communicating. In the next part, we'll look at another early sign that often appears just as briefly. A change in vision that many seniors dismiss because it resolves on its own. Another early warning sign many seniors experience is brief changes in vision. It may feel like the room suddenly darkens, or your vision becomes blurry for a moment. Then, just as quickly, it returns to normal. This often happens when standing up, bending down, or changing direction. Some people describe it as needing to blink a few times before seeing clearly again. Because the symptom passes so fast, it's easy to ignore. Many seniors assume it's related to their eyes, or they blame lighting, fatigue, or dry eyes. But these short visual changes are often linked to blood flow rather than eyesight. The visual centers of the brain are extremely sensitive to changes in oxygen supply. Even a brief reduction in blood flow can affect how clearly you see. When circulation adjusts smoothly, the brain receives what it needs without interruption. But when blood vessels respond more slowly, vision may dim or blur temporarily. This does not mean permanent damage is occurring in that moment. It means the system is under strain, and strain that happens repeatedly can matter over time. What makes this sign easy to miss is that eye exams often come back normal. Vision may test well. Eye health may be fine, so the symptom gets dismissed. Over time, some seniors begin adapting. They pause before moving. They avoid sudden position changes. They wait for vision to catch up before walking. These adjustments can reduce discomfort, but they don't address why the brain briefly isn't receiving enough blood. The important factor is not how dramatic the visual change feels. It's how often it occurs. Occasional dimming can happen to anyone, but repeated episodes suggest the brain is struggling to maintain consistent blood flow during movement. Noticing this pattern early gives seniors a chance to support circulation and reduce strain before other symptoms appear. Next, we'll look at a sign that affects thinking and reaction time. One that many people assume is simply a normal part of aging, even though it can be linked to reduced blood flow to the brain. Another early warning sign that often goes unnoticed is a subtle change in thinking speed and mental clarity. Many seniors describe it as feeling a little foggy at times. Not confused, not forgetful in a dramatic way, just slower than usual. You may notice it takes longer to find the right words. You may lose your train of thought mid-sentence. Or you may feel less sharp when making simple decisions. Because these changes are mild, they are often blamed on normal aging. People say things like, "My mind just isn't as quick as it used to be," and then they move on. What many don't realize is that the brain's ability to think clearly depends heavily on consistent blood flow. Thinking is an active process. It requires energy, and that energy comes from oxygen delivered by the blood. When blood flow to the brain is slightly reduced, the brain adapts by slowing down certain processes. This doesn't cause sudden confusion. Instead, it creates subtle changes in focus, reaction time, and mental sharpness. These moments may come and go. You may feel clear in the morning but foggy later in the day. You may notice it more when standing, walking, or after long periods of sitting. Because the symptoms are inconsistent, they're easy to dismiss. But inconsistency is often part of the pattern. As blood vessels become less responsive with age, the brain may not receive steady support during every activity. Small dips in blood flow can occur during movement, changes in posture, or even mild dehydration. Over time, repeated small disruptions can make the brain more sensitive. Mental fatigue may set in more quickly. Concentration may feel harder to maintain. This does not mean serious cognitive decline is happening. And it does not mean memory loss is inevitable. It means the brain may be working with less support than it needs to function at its best. Many seniors quietly adapt to this. They avoid multitasking. They take longer breaks. They accept a slower pace without questioning why. Adaptation helps manage daily life, but it can also hide early warning signs. Recognizing changes in mental clarity as a possible circulation issue rather than just aging can shift how seniors respond. Instead of dismissing these moments, they can begin to notice patterns and support overall brain health more intentionally. In the next part, we'll look at another early sign closely tied to circulation, a change in balance that many seniors experience before any serious problems appear. Another early warning sign many seniors notice is a subtle change in balance. Not a fall, not a dramatic stumble, just a feeling of being slightly unsteady at times. You may feel less confident when walking on uneven ground. You might hesitate when turning quickly. Or you may reach for furniture more often without thinking about it. Because these moments don't lead to falls right away, they're often ignored. Many seniors assume balance naturally worsens with age, so they adjust quietly instead of asking why it's happening. Balance depends heavily on the brain. The brain continuously processes information from the eyes, inner ear, nerves, and muscles. To do this well, it needs steady blood flow. When blood supply to the brain is reduced, even slightly, balance can be affected. Signals may be processed more slowly. Coordination may feel less precise, and the body may take longer to react to changes in position. This can create a sense of instability, especially during movement. Walking feels less automatic. Turning feels less smooth. Over time, many seniors adapt their behavior. They walk more carefully. They avoid unfamiliar environments. They limit activities that once felt easy. While these adjustments may reduce risk in the short term, they can also mask the underlying issue. The body compensates instead of correcting. What's important to understand is that balance changes often appear before more serious symptoms. They are early signals, not late ones. Because balance issues don't usually cause pain, they don't trigger urgency, but they do increase fall risk over time. Recognizing subtle balance changes as a possible sign of reduced brain blood flow allows seniors to respond earlier. Earlier awareness means more options. This doesn't mean every balance issue is serious, but repeated moments of unsteadiness deserve attention, especially when combined with other signs like dizziness or mental fog. Understanding how balance connects to circulation helps explain why these changes matter and why they should be noticed rather than dismissed. Next, we'll look at one more early warning sign, one that often feels strange or unfamiliar, appears briefly, and then disappears before most people think to mention it. One of the most easily overlooked warning signs is a brief, unusual sensation in the body. It may feel like tingling, numbness, or slight weakness that appears and then fades away. These sensations often affect the hands, arms, face, or legs. They may last only a few seconds or minutes, and then everything feels normal again. Because the symptom disappears, many seniors assume it was nothing. They may blame posture, sleeping position, or a pinched nerve. But these brief sensations can sometimes be linked to how well blood is reaching certain areas of the brain. Different parts of the brain control sensation and movement. When blood flow to these areas is temporarily reduced, the signals they send can feel altered or delayed. What makes this sign especially confusing is that it doesn't follow a clear pattern. It may happen once and not return for weeks, or it may occur occasionally without warning. Because it's unpredictable, it's easy to forget. Over time, however, repeated episodes can indicate that circulation is not as consistent as it should be. The brain compensates. The sensation passes, but the underlying strain may remain. Many seniors hesitate to talk about these sensations because they don't want to overreact. They don't want to worry family members. and they don't want to feel like they're making a big deal out of something small. This is understandable, but it's important to remember that early warning signs are often subtle by nature. They are not meant to be dramatic. The key factor is not intensity, it's repetition. Occasional tingling can happen to anyone, but recurring, unexplained sensations deserve attention, especially when combined with other signs like dizziness, balance changes, or mental fog. Recognizing these sensations as possible circulation signals allows seniors to stay aware without becoming anxious. Awareness creates space for thoughtful observation rather than dismissal. When early signs are noticed, there is often more opportunity to support the body before more serious problems develop. In the next part, we'll talk about why so many seniors overlook these warning signs, and how common beliefs about aging can prevent early action, even when the body is sending clear signals. Many seniors don't ignore early warning signs because they don't care. They ignore them because the signs don't feel urgent. There is no pain, no clear injury, no dramatic moment that demands immediate attention. When a symptom appears briefly and then disappears, it's easy to assume it wasn't important, especially when life continues as normal afterward. Another reason these signs are overlooked is fear. Some seniors worry that mentioning small symptoms will lead to unnecessary tests or unwanted changes. Others fear being told something is seriously wrong, so they prefer not to ask questions at all. There's also a strong belief that aging naturally comes with decline. When dizziness, balance changes, or mental fog appear, many people assume it's just part of getting older. So instead of investigating, they adapt. They move more carefully. They slow down. They avoid situations that feel uncertain. Adaptation feels practical. It allows daily life to continue without disruption. But it also hides patterns that deserve attention. Another factor is how symptoms are described. Because these signs are subtle, seniors often struggle to explain them clearly. They may feel unsure how to bring them up during medical visits, so they don't mention them at all. Over time, the silence becomes routine. Small signals repeat, the body compensates, and awareness fades. The problem is that early warning signs are often the most useful ones. They appear when there is still time to respond, when support can still make a difference. Ignoring these signs doesn't make them go away. It simply delays recognition. Understanding why signs are overlooked helps shift the conversation. Instead of asking whether a symptom is serious enough, the more helpful question becomes whether it is repeating. Patterns matter more than intensity. When seniors begin noticing patterns rather than dismissing isolated moments, they gain valuable insight into how their bodies are functioning. That awareness can lead to better conversations, more informed choices, and greater confidence. Paying attention does not mean living in fear. It means staying engaged with your health as your body changes. And engagement, more than anything else, helps seniors remain proactive rather than reactive as they age. Early warning signs of reduced brain blood flow are rarely dramatic. They don't shout. They whisper, a moment of dizziness, a brief blur in vision, a slight change in balance, a feeling that thinking isn't quite as sharp as it used to be. Individually, these signs are easy to dismiss. They come and go. They don't cause pain, and they don't stop daily life right away. But together, over time, they tell a story about how well the brain is being supported by circulation. What matters most is not fear, but awareness. Awareness allows you to notice patterns rather than isolated moments. It helps you understand when the body is adapting smoothly and when it may be under strain. Many seniors assume that once they reach a certain age, these changes are out of their control. But in many cases, early awareness creates options. Options to support circulation, options to protect balance, options to maintain clarity and confidence in everyday movements. Paying attention to early signs does not mean something serious is happening right now. It means the body is communicating. And communication gives you time to observe, time to ask questions, time to make thoughtful adjustments rather than reactive ones. Small, consistent changes often have a greater impact than dramatic actions taken too late. Staying hydrated, moving regularly, noticing how your body responds to standing, walking, and daily activities. These habits support the systems that deliver blood to the brain, and they help reduce the strain that builds silently over the years. If you've recognized any of these signs in yourself, take that awareness as a positive step. Not as a reason to worry, but as an opportunity to stay engaged with your health. In the next video, we'll look at everyday habits that quietly reduce blood flow to the brain after 70. Habits many seniors follow without realizing their long-term impact. Understanding those habits can help you take control earlier and support brain health more effectively as you age. Thank you for spending this time learning about your body. Staying informed is one of the most powerful ways to stay steady, confident, and independent in the years ahead.